Good afternoon, everyone. Welcome to our webinar held today. My name is Rebecca Rabbitt, and I'm the Vice President of Government Programs, Medicare at Express Scripts. And I was asked to give you a little insight into what goes on in the PBM and how pharmacists are involved. I'm going to begin by setting the stage a little bit with an opportunity that we have, and then I'm going to outline some of the key roles pharmacists play in the PBM world. I encourage you to submit questions. I will wait till the end of the presentation, and then we'll leave some time to make sure that we can answer those questions. As you can see here, there's unprecedented growth in prescription drug volume in the past years. Driving growth in utilization is the accelerating U.S. aging population, the prevalence of chronic diseases, increased life expectancy, healthcare reform, and increased healthcare expenditure overall. In 2015, federal actuaries reported that the U.S. spending growth jumped to 5.5% in 2014. And that was a trend that actually been going down, but it was driven back up to expanded coverage, the revived economy, and baby boomers aging and using more healthcare services. Estimates are now that this will increase to 6.6% by the year 2020. The report also noted for the very first time that pharmaceuticals jumped from 2.5% to 12.6%. And this was actually the first time this report actually garnered the attention of pharmaceuticals. But I'll talk more about that later. Interestingly, this article noted that increases may have been even larger, but consumers were actually picking up more of their share of the medical bills. By 2024, it's estimated that healthcare will comprise a fifth of the U.S. economy, and it's going to exceed the average growth in the gross domestic product by 1.1 percentage points. In 2013, the pharmacy trend was 5.4%, and this was interesting only because it increased after several years of decline. This information is from the Express Scripts Drug Trend Report, and while I'm reporting on 2013, we will be reporting 2014 very soon. These changes were driven not so much by utilization, but by an increase in unit cost and specialty. Some key findings was that the U.S. spent 13.2% more on prescription drugs in 2014 than it did in 2013. More than half of the increased spend was due to the rising costs of treating hepatitis C, as well as increased costs associated with compounded medications. If we remove these two therapy classes, the overall trend would have only been 6.4%, about half of what we actually saw. Diabetes remains the leading therapy class for the fourth straight year based on total costs. In 2014, there were more than 4.2 billion prescriptions dispensed, costing more than $300 billion. The PBM today is integral to processing prescription drugs. And not only are prescriptions processed electronically in a matter of seconds, but they're done with a host of clinical safety and benefit rules. The PBM effectuates these rules on behalf of employers, health plans, unions, states, or other payers. But the overall goal of the PBM is to improve health outcomes, and we do that by managing the financial costs and making sure that there is lower cost for the payers, which makes the care more affordable for all of us, but ultimately that we get clinical outcomes, that there's greater safety for our patients that are using medications, and that we're actually achieving the outcomes that we want to see with regards to health status. In addition to processing prescription, PBMs negotiate rates with providers, and these are mostly pharmacies. They also negotiate rebates with the pharmaceutical manufacturers, and it's all to help the left side of that previous graph, which was to help manage costs. And though cost control is a significant factor, there's also a group focused on clinically sound formulary offerings, clinical product offerings, and making sure that the care delivers safety in the use of medications for the patients. So if we look at, there's like three major areas of how the PBM is organized. One of our goals today in the webcast was to provide more of an inside look at what happens within the PBM and expose some of the roles that pharmacists hold. I know that when I graduated, I was not aware of the variety of roles that could be held. Even when I joined Express Scripts in 2003, I was impressed with the number of roles that pharmacists could hold. The role I hold today didn't even exist in 2003 when I started, and new roles continue to evolve as healthcare evolves. Generally, the business can be described in three segments. On the left, we have the payers or the clients. Those that they contract with the PBM to manage and execute on the pharmacy benefit. In the middle is our core set of services, which is serving patients, and we do that through call centers, through home delivery, through specialty pharmacies, and those are at the core of our service and our operations. On the far right, we could not do that without working collaboratively with our supply chain, and that includes the pharmacies and the pharmaceutical companies. So that's going to kind of frame our discussion going forward here. If we want to take a look at what happens really behind the scenes and thinking about how I just framed the business in those three segments, on the left-hand side, we have the payers, the health plans, the employers, the unions, could be the Department of Defense, anyone who's paying for the pharmacy benefit. In the center there, you see we have our patient. The patient is the focus of everything we do, because if we don't serve the patients well, the rest of this really doesn't matter. From a government programs perspective, which is where I spend the majority of my days, it's all about the patient and assuring that they have access to their medications. On the right-hand side, we have our supply chain, and these are the groups responsible for providing the medications to the patients. So you can see here that we have the retail pharmacy, we have the specialty pharmacy, and mail order pharmacies. And they interact with our patients on a daily basis. Our patients can also interact with the PBM, and you see them in the middle there. They can interact through our call centers or through our direct pharmacies. But what I have illustrated here is what's happening behind the scenes to make that benefit work for the patient and for the payer. So we talked a little bit about call centers, which could be clinical call centers, and I'll talk more in a few slides about that. Building formularies, which will determine which products are actually adjudicated or covered under that benefit. But along with that, appropriate clinical and safety rules. So this is where all of the prior authorization, all the step therapy, drug quantity management. You've probably now experienced lots of edits around opioid and acetaminophen utilization are all done by clinical groups within the PBM to set what those criteria might be. There's also clinical consultants that not only advise our clients on how they should build their benefits, but clinical consultants can also advise our patients who bring to us very complicated medical conditions. And then we have a lot of negotiation that goes on in order to establish our pharmacy network as well as offer rebates for the medications that are on the formulary. As you can see here, there's many functions within the PBM, and there's many roles that a pharmacist can fill, most of which are pretty non-traditional. The roles I'm going to talk about next will give you some insight into what they perform as part of their day-to-day in supporting our patients. I mentioned a little bit earlier that there are clinical consultants that work at the PBM. They may interact indirectly with us through some of our call centers or our pharmacies, and the PBMs support many types of outreach programs for patients. What I'm highlighting here is what we're going to call a therapeutic resource center. And Express Scripts has 7 therapeutic resource centers throughout the country. They offer specialized care to patients. Maureen works in the Diabetes Therapeutic Resource Center here in St. Louis. These pharmacists are trained in depth to identify and perform consultation with patients who've been identified with opportunities. And the opportunities can come from predictive modeling that we use to try to identify who might be non-adherent with their medications. We can also find patients through the presence of multiple complicated disease states and very high drug spend. Or we can simply get an inbound call where we identify a gap in care that can be resolved through a quick conversation with a pharmacist. As you can see from this note, Maureen finds making a difference in these patients' lives very rewarding. We also have roles in creating the clinical foundation of the formularies and the programs that we offer. What's really important to our patients when they select a plan, even with their employer, is knowing what medications are covered. What's important to our clients is having a clinically sound formulary that really helps control costs. These clinical pharmacists are essential to reviewing the literature, reviewing new or changed drug information, preparing recommendations for our P&T committee, educating account teams, and as well as clients, and our internal call centers with key information on new drugs, so that whenever we have an interaction with a beneficiary or a patient, that they can receive expert advice from that person. These teams follow patent expirations, they follow the new generic drug market, they follow drugs entering the market, and they were really essential in helping us build our strategy around the new PCSK9 drugs. As the market moves to a more regulated benefit, the importance of compliance really cannot be understated. Not only do our PBM policies and operations need to comply with federal and state rules, but so do our operating pharmacies. And this is Doug's full-time role at Express Scripts, and it's a good portion of my role on my team and many people on my team. In addition, we have a full compliance department that helps track and monitor and provide advice on how we can best comply with the new rules and regulations. Drug procurement is working closely with our supply chain to make sure that we're delivering value to the payers of the drug benefits. So in order to help manage the cost of the overall benefit, we work really closely with pharmaceutical manufacturers and we negotiate discounts as well as rebates. Often thought of as just for branded medications, there's been an increasing need to have strategies around generic drug procurement, and they've taken even a larger role as the dynamics and pricing of drugs has changed over the last year. As you can see here, Jan loves learning something new every day, and her job as the Chief Sourcing Officer allows her that. And I know she's been with ESI for quite a while and has held many different and challenging roles. But there are also opportunities in what we call special markets. Supporting special markets really didn't even exist 10 years ago. So in addition to Medicaid, we have special markets in healthcare reform and Medicare. The clinical rules around what can be done with the formularies or the utilization management programs really differs by state and requires a level of expertise and specialization that general practitioners often don't have. And when you look at these special markets, you can see different approaches are required. For example, with Medicare, you're primarily dealing with the elderly population, high utilizers, and a very strictly defined benefit, one set with a set of national requirements. The majority of these patients have hypertension, diabetes, and high cholesterol. All very challenging conditions for this population. But quite differently, the Medicaid population is generally younger. They're a poorer population, and they're often dealing with asthma and much more acute conditions. So what we might do in Medicaid would be very different from an approach we might take for Medicare. Healthcare reform brings even a different mix to this. It's not Medicare, it may be a little bit of Medicaid, but it's often a very wide mix of individuals, mostly those who were previously uninsured for a variety of reasons. I've talked a little bit about some of our patient contact centers. Earlier talked about our therapeutic resource centers where we can call and provide, or members can call and provide, get very specific drug consultation, and disease state therapy consultation in specialized areas. But we also have other types of patient contact centers where we need to make sure that medications are used appropriately, and we have an opportunity to intervene where we have identified any gaps in care. Here we have a different type of contact center. This one is focused on helping patients with limited means obtain medications that are too expensive for them to afford. These pharmacists work with pharmaceutical companies to make the medications accessible through patient assistance programs, and they work with the patients to help them get access, support them clinically, and work with their physicians. Jan's worked in a variety of operation and contact centers at Express Scripts, including our coverage review area. Currently, she's working in our patient assistance program area, and we're able to make a difference in the lives of these patients and get them medications they would not normally be able to afford. A little more on the business side of things, we have account executives. In many cases, they are also pharmacists, and they're really there to help assure that the payer's needs are being met. They can hold a clinical role or a more strategic role. Those in the strategy roles are responsible for helping clients achieve their financial goals, as well as the goals they might have around serving their member populations. So you can think of an employer as having a goal of making sure they can continue to offer employee drug coverage with increasing costs. For unions, they're primarily concerned with making sure their members have a really good benefit and that they have access to the medications that they need. For health plans, many of them are also serving employers, and they want to be able to offer an integrated benefit, medical and pharmacy together. Health plans may also be in the consumer market, and so helping them build a benefit that is competitive in the market and allows them to attract new members is very different from offering a service to an employer who has a very contained and closed population they want to serve. Julie supports health plans who want to attract employers as well as offer an individual benefit to members. So in this case, she's servicing a client that has multiple needs. She's supported by a clinical account executive. In these roles, the clinical account executive will prepare clinical information for clients that helps them make more appropriate formulary choices. They often participate in helping to customize the benefit, customize the rules, do analysis on drug utilization in their population. They might make recommendations as well as present or participate in the Pharmacy and Therapeutics Committee meetings, either internally or with their clients. You can see here that Andy really enjoys being a key participant in helping clients manage their pharmacy benefit. He's made an analogy of his role as being as valuable as a Swiss Army knife in the tool chest for our clients. The last role I'm going to talk about is really in our provider network solutions area. So this is a team of pharmacists that are responsible for contracting with the pharmacies to participate in our networks and serve our members who are part of various payer plans. So similar to what Jan did with our supply chain and working to procure drugs, Isaac represents a role that works to build network solutions with our pharmacies. One of the more interesting products his team has developed recently is a quality network initiative, where we partner with the pharmacies, the health plan, in order to drive patient adherence and reduce the use of high-risk medications. The initial results have been really promising from a quality outcomes perspective, and I've been really pleased at the excitement that the pharmacies and the actual pharmacists participating in these networks have said how much of a difference it has made in their day-to-day work. And the fact that their management has supported them actually driving positive clinical outcomes in their patients have been something that they've really been looking forward to for quite some time. So I know I covered a lot of information about how the PBM works, about some of the roles within the PBM, and as you can see, there's lots of opportunity for pharmacists within this. So I hope it was helpful to you. I hope I achieved my objective of covering a little bit about what happens behind the scenes and some of the opportunities that pharmacists can fill within the PBM. And with that, I think we have a little bit of time to take some questions. I think if you want to go ahead and submit your questions through the chat box, and I'll be able to read them and answer them. All right, we don't have any questions, so I must have achieved my objective today. Thank you very much for attending. If you have any questions that come up later, I'm sure you can send them, and we will make sure that we get them answered.